Hi, everyone. Welcome to the Bold, Beautiful Borderline podcast. It's your host, Sarah, and today I am really excited because we are talking trauma, and there's nothing more relevant to the borderline experience. I have a fellow social worker with me here today, Estefana Johnson, who's going to talk about her experience and her work in the field, and specifically a new, to me at least, therapeutic modality for treating trauma. So, please introduce yourself. Tell us who you are and why you're here and what you're about.
So I'm Estefana Johnson, and I am super excited to be here. I'm a trauma clinician and the director of clinical training for Arise Alliance out of Tampa, Florida. But I live in Arizona, so I practice in Arizona. And I'm here because I've been in the field for about 20 years, and there's so much that you experience working with trauma that became my specialty, both because of lived experience and just how kind of the path was laid out for me. And I think there's so much misconception about the lived, like being human, that's it. Like there's things that happen that we tend to pathologize, things that we do that we pathologize, meaning like we put labels on it. And I think the what's really brought me here is this like my own need to feel more understood or understand myself and understand family members better. There's definitely a lot of adversity that we faced. Being Hispanic, first generation Mexican American, uh, all of your differences are highlighted already. And then you add to that trauma, you add to that the adversity of like not knowing the language, the educational barriers, all these things. And it can be very difficult to navigate just the world. So I have a lot of passion for people who are the outliers, that are kind of like the misfits and don't quite fit in these labels and these things that we say are going to help, but sometimes they just end up feeling worse because you think you know better, you should do better, and this is just not how the body works. So that's my passion, trying to educate. I joined an amazing team that also was looking for, we have so many amazing trainings out there, so many modalities and approaches for treating trauma. And in the name of fidelity, we're taught to be very rigid. Do it this way. These are the steps, and you have to follow that, or else you're no longer following evidence-based approach. And we call that like one size fits all, or all sizes fit one, and that's not how life works. So I've always kind of been the rebel in our field, just tweaking a little bit, training people in a modality was like, this is what I'm supposed to tell you. But in practice, this is what I've observed, and this is why I think this is, what research I've researched, and this is what it tells me. So this is what I tell you as a trainer. This is what I tell you as a human being. And I just kind of got tired of that. I'm like, I'm not being congruent with myself. I'm not being authentic. I kept getting my hand slapped, in trouble for not teaching it the way I'm supposed to. So when I joined this opportunity, it was like, we got to create something truly integrative that truly is made to accommodate the individual needs and not push them into what we think they need to do or what we think the issue is. So that's where CMI came in. And then, we're just trying to spread the word. So I love people like you who are willing to just sit and converse with us and talk.
I love it. Yeah. Tell us like what is CMI? What does that stand for? Critical memory integration.
Yeah.
What does this mean and how do you see well, before you tell me that, how do you see trauma as unique from like the borderline perspective? I know we don't, like you said, we
Yeah.
don't want to pathologize, but BPD is a very interesting lived experience and the trauma
Yes.
presentation is different. So what has been your experience in observing that?
So I mean, first of all, I try to stay away from the word trauma and call it more adversity, right? Because you could have two people who go through the exact same horrific event, and one seems to get strengthened by it, and another just completely destroyed by it. And so that was one of the things that was driving me. Why is it that you got 10 vets that go through the exact same incident, and like four end up with PTSD and the other six don't? And we knew there's childhood adversity with these four, but why? Why does that impact how they process this experience was more of the question. So I think first, number one, we tend to want to simplify, the human experience, and we say, okay, for example, the DSM, to have PTSD, you meet these criteria. And then these criteria come from these specific incidents. So you could have these symptoms and not meet these criteria, right? Or you could have these things that happen and not meet these symptoms. So it's not a very clear, what is it, realistic, I guess, model that speaks to like universal truth. Because I've had people who they go through a breakup and they're avoiding the situation. They're obsessing, like their thoughts are having flashbacks, they're having nightmares, they're having all of the things that would qualify as a PTSD diagnosis, yet it wasn't a trauma per se to meet the criteria of what a trauma would be. And all of those things is what was confusing to me. When there are things that are not identifiable. So for example, I have, attachment issues. I struggle with connecting with relationships. I over respond to things. I'm a little extra. Being Mexican, we're all extra. So like I'm a little bit loud and I say I call it spiciness. But all of these things. And then you ask me, well, did you have, let's look at the 10A scores. And you're like, well, no, not necessarily. Well, they can't understand. Like, why would you, this doesn't match in my head. So there's something wrong here. And they just kind of shove it into this complex trauma because you can't quantify it. You can't label it or define it into this category, and then they turn it into a personality, right? A personality disorder. I mean, we look at things different in terms of CMI as it's all adaptive. It's an adaptive response. There's a reason why you are responding the way you do. And if I'm telling you the reason, I'm telling you here is the checklist of what would make that reasonable, I'm completely missing the point because you might not even know. You might not recognize. I mean, we don't remember everything in our lives. We remember a very minor portion of what really happened and what we went through, unless you have one of those super memories where you can remember the day you were born. Most of us don't. So when we're looking for the obvious answers, that's not what holds the key. And that's the problem in our industries. We're looking for something obvious and logical, and it's not that simple. There are things that we experience in life that kind of drive the trajectory of where we go, how we interpret our value, how we interpret relationships, how we interpret the world, what we feel about emotion, about needs, about connection, and all of those factor into how we are now. And those things might not be listed on the, on the ACE score or on the trauma checklist or any of that because they're not that clear cut, and yet they control and dictate a lot of how we function. That's what we call critical memories. That's why we're not calling it trauma memory integration. We're calling it critical memory integration, because whether it's a trauma or not, it's not about the event itself, rather how we interpret it or how we adapted to the event or the experience that has now been outdated. Maybe we never updated it, and it hinders our capacity to function in the now, to connect in the now, or to fully embrace ourselves or be ourselves. It's very complicated, but essentially, yeah, CMI is the way to get at these experiences. It's not going to happen through logic and discussion because you have to be conscious, right, of those things. And sometimes when we're looking for the easy answer, that's what derails us from the truth. It has to be a felt experience. So with CMI, we're teaching people to tune into their inner signals, go in and a lot of times these aha moments emerge from within into things that you didn't even know, you didn't even think had an impact on you, and they did. So it's amazing to see. I mean, some of the clients that I see, sometimes they come in with these big problems and you think, here's the obvious answer. And then we connect and it's this like moment that seems almost not really impactful that completely sent them in a different trajectory.
Yeah, it's interesting how I've actually been reflecting a lot about this in my personal life. Some of those like micro moments in childhood that continue to
Yes.
come up.
Yes.
And I have this memory of being in the back seat of a vehicle with one of my parents, and they like ripped this thing out of my hand, which, in the grand
Parents do sometimes.
and in the grand scheme of the trauma I've seen in my life, that is not like it doesn't matter. But I have come back to this one moment, and it's almost like it represents the the tenseness that was
Yes.
felt across the childhood experience.
Yes.
And it's sort of like can all be categorized in this ripping of this thing out of my hand because it was bothering my parent or whatever. And that just came up for me again as you were talking about this of like it might not be the obvious signals.
No. And I'd be curious, Sarah, about if you were to really like sit and digest this, if there are other areas in your life where you felt something you held, either part of your identity or who you are, was not allowed, was ripped away because it was not convenient or it was not aligned with those around you. And it's like that complex thing of pick a day. I mean, I grew up in a cult, it was religious trauma, and I was forced, like, you can't wear pants, you can't cut your hair, you can't have an opinion, can't wear makeup, it's a Jezebel, all these rigid rules. And everything that I wasn't that. So I'm a loud spoken, opinionated, creative, impulsive individual. And that was part of that first betrayal of I have to accommodate, I have to modify myself to fit in that thing. How do you describe that? Nobody died. Do you know what I mean? There's no criteria. It's the daily denial of my true self. And how do you quantify that? How do you fix that? Right? The only way is like, that the core you is still there. It's always been there. And so what we're doing is helping people to reconnect to that, work through those layers more efficiently, because we're not sitting there and validating and exploring and all those things. It happens organically. It's just once you can see it from the perspective of the observer instead of the experiencer. But perfect example, that's a critical memory for you.
Yeah, and it's interesting too because I don't know if you've heard this with folks that you've seen, but it's like I've gone to therapy and I've done so much work. I've done the EMDR around the big things, right? I've processed the rapes or the suicide or the like, the parent,
Obvious.
whatever. And but there's still these underlying symptoms or struggles, and it's getting to those things. So it sounds like CMI could be really helpful in this way.
Yeah, that's exactly what it was fit to do. That's exactly what, as a trauma clinician, I used to look at I think my role, I thought, well, how do we make it not hurt? Right here's this event, you're having bad nightmares and dreams and flashbacks. And I found this amazing approach prior, the one that I used to train in, and now it eliminates the flashbacks, it eliminates the nightmares. I'll give you an exact example I had with a client I had. I was seeing her when she was a kid, had been a victim of sexual abuse, and the flashbacks and nightmares. And we use this, using eye movements and stuff to reprocess and replace those images. And then this kid grew up in the system, in the foster care system, and did fantastic work, a lot of progress, a lot of, kind of followed me along to when I went to private practice. And she came back about a year ago, just now as an adult, and said, I came to see you because I don't understand why I keep putting myself in situations where I'm getting assaulted. Doesn't make sense. I know that this guy's a creep. I know what his intentions are. Why would I go to his house when he invited me for dinner? Why would I have a drink when I know that's not going to lead? Like, and so it's this self-hatred of why now it's my fault because I know better and I'm not doing better. What's wrong with me? And this is a child. I mean, we went through, and the very things that we had desensitized is where the answer was held. Because what really it came down to, and this can't be something you can work through logically, you have to re-experience it. You have to connect to it. It's the only way your brain's going to record it. And she was able to recognize that at 5 years old, you could have all the intuition and say, this is wrong. I shouldn't do this. Something bad's going to happen. And you had no choice other than to go along with it and follow through on that because it's the only way that you could live through it. And that was the programming that helped you survive. The problem is that was the only choice you had back then, but now there's other choices, but you don't know how to make those other choices because this thing is controlling you from the depths of your subconscious mind. And so going through that together, because now I serve as an anchor for her in the present, she was able to integrate that experience. She was able to uh, activate that memory, change the way, that role, essentially that policy procedure manual is what I call it, that was adapted at that time, and update so that she gives herself permission to follow her intuition, to say no, to walk away, even if it disappoints or they're upset or offended or whatever. Who cares? Because it becomes about keeping me safe. And it was like essentially giving yourself permission to disrupt that relationship for the sake of your safety. And that is very complex way. Like only the person who's gone through it would be able to tap into that, access that memory, reconsolidate it, change the way it's stored. And I could tell you with this kid, I mean, by the next week, she's like, I've cut this person, this person, this person out my life, like boundaries that we could talk around, but to act on it is different because it's a visceral response that's driving you. And those specifically, those things, it's like nobody has ever asked you when they're doing your assessment for trauma, has anyone ever ripped something out of your hand? It's not a question on a trauma questionnaire. Do you know what I mean? It's like, and those are the moments really that hold the key. And I don't even know my own moments, much less how would I know to share them with you? You're not, it's beneath your conscious awareness. So that's why we have to do things differently. You're looking for the obvious answer. Like our questions sometimes misguide people to an obvious answer, but that's not the accurate answer. You know, it's something deeper. And with CMI, our approach really is about moving out of the way, holding the space, and putting the parameters to make it safe for an individual to be able to visit those experiences and gain that understanding, that wisdom that it brings by really truly integrating, not desensitizing, but integrating that experience. Now you're able to see where it's coming from, not here, but over there.
Yeah, that's the kind of trauma work I would do with people. I'm not into the EMDR stuff. I think it's a beautiful
It's
modality for the
powerful and
people
it's
that it
helpful
works
for, yeah,
for. Yes, absolutely.
not all size fit one. It's
No,
not, yeah.
no, no. Yeah, that this is what you had to do to survive, and it's not, you don't have to survive anymore. Kind of like statement is so simple, but then when you put it into practice, it's like, but my body is familiar with going to dinner with this person. That's what I have known to
Yes.
do.
Well, it has to, only an emotion experience can override another emotion experience. You can't override it with logic. You have to, because your body has its own way of prioritizing its response, and survival will always trump logic, right? So everybody knows it's bad to eat out of dumpster. Like, don't go digging for sandwiches out of a dumpster. Everybody knows that, right? There's infections, you can get diseases, blah, 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 whatever. But if any of us had been starved, we're at war or something, and we've starved for like 4 days, our survival mechanisms are going to trump our values, our ethics, our morals, all that stuff, because that's how we're wired as humans. So this is the problem with coming in with a moral or logical approach into something that needs to be felt and experienced, needs to be integrated, needs to bring to conscious, be brought to conscious awareness.
And so, what does that, like, if a listener wanted to do CMI, what does that actually look like in session or in practice?
So we start off first, of course, by every CMI clinician is, we start off by teaching them to do their own integration, right? So for myself, we were talking a little bit earlier, being Hispanic, first generation Mexican American, there's a lot going on politically right now that had brought up a lot of my own experience as a child of immigrants. And so if I have a client who comes in, I've had clients on both sides that are very, there are DACA recipients that are terrified, and I might over empathize, like, fall into that victim or fall into that helpless state with them. That's not going to help them. I mean, being seen and connected goes to a certain level, but then what do you do after that? Well, if I haven't worked through it, how am I going to guide them through it, right? But also on the other side is if I have somebody else who's, very conservative, and I understand, I have a brother, ironically, that's like way on the other side of the spectrum, and how do I connect with them, while still respecting my own individual lived experience? My purpose for connecting with them has to be greater than my pain, right? It has to. That means that I have to have already integrated connected with my own experience, come to peace with it essentially, because now I've given it purpose. I've given it meaning. I've recognized that I've overcome those things. And I now have the map to help other people navigate, not my way, but their way. But I can confidently say, keep going. You're going to find the answer. Your answer is unique to you, but you're going to find it. And the space that I hold for you has to relate that to your nervous system. It has to communicate that, not verbally, but with the space that I'm holding. That means that when you put your biggest, nastiest, ugly thing on the table, there's no wincing, there's curiosity. I'm there with you. I don't have to tell you that I don't judge. You feel safe doing that, right? So we can be curious about it. We could dig through it. You could sift. You could find the thing that you're looking for. And that's the space that we have to be able to provide. We can't do that if we have not worked on our own integration, because our own signals will come up. So any clinician that has been trained in CMI, I can assure you, has gone through this process before they hold that space for you. Secondly, you come in and know that we are not the expert. You're the expert of your life. I may be the expert in like learning about, emotion or memory or these things. I'm the expert in my own life, but I don't have your answers. You have your answers. And I have to essentially communicate that in the way I speak with you and how curious, I am. There's no assumptions made, which also includes I'm not labeling things, right? It's, hey, here's the thing that you did to survive. Let's explore that. Let's go into that. So when you come in, a lot of times people will come in and say, I have anxiety, or I don't learn things. I have an anger issue. Tell me more about how you experience anxiety. How do you experience the anger? What is a problem for you? Because if you see it as, if you're targeting something that other people tell you is a problem, that's going to be really hard, right? We start off with what you see as incongruent with who you are. Why? Because I know that there's something deep inside of you that's telling you this is not it. That's what we call the core, and we call this a signal. If someone is telling you, nah, you're just trying to distract from that thing that happened with your mom or that thing that happened with your dad. Now I'm placing myself in the know-it-all, like the benevolent dictator of how your healing should go. That's where conflicts arise. That's where people get stuck. Because number one, who am I to say that that's the thing that screwed you up? That might be an adversity that you went through, but that might not be the thing that led to this adaptive response. Neither of us know that. But the bigger piece is that the whole process should be helping you get to know yourself better, get to trust yourself better. And so by me trying to tell you what you need to do is already disrupting that, right? I'm already getting in the way into the thing that's not my role. So I would be curious with you, like, what are you showing up? What is an issue for you? And you tell me, oh, I just get pissed off because they run out of vanilla creamer at work and I get so pissed off. And I know you have all these, you tell me there's all these traumas, but those don't bother me. Okay, we're going to work from the vanilla creamer. That's where we're going to start, because that's the thing that's bothering you. And you know what that tells me? There's something about how you respond that you feel is not congruent with who you are. That's what that tells me. That's what we call a signal coming from the part of you that's telling you, hey, you're being a little extra right here. That's the part of you that has the answer. That's what we call the authentic you. And so working through that, just like you talked about this thing being ripped out of your hand, being curious with that. What happens up in your body? What shows up in your body? And let's follow that. And I'm holding the space where it's safe for you to be uncomfortable, but present, right? We call that dual awareness. Like, you can feel the pain and the fear from back then with the safety of knowing that you're here now with someone who is going to hold that space for you, kind of hold that. The rope, I picture you going on into the cave, but you can always find your way back. And that's the extent of my role, is to make sure that I'm staying anchored so that you have an anchor to come back to, but also feel safe enough exploring the very things that were terrifying before. Because it helps when you have, when you have somebody like, hey, let's roll, let's do it. It's scary when you're by yourself. And so it's very much a relational approach. We try to stay away from explaining. So we say, don't explain, experience. Why? Because when you use logic, it takes you out of the experience, right? We want to go internally. Because it's internal, you don't have to share details with the clinician. So that it's a lot more efficient. I find this is especially helpful when some of those events or experiences bring a lot of shame, a lot of guilt, and that tendency to want to hide. You don't have to expose it to be able to experience and connect to it. And I could tell you more often than not, afterwards, they want to share with me, like this thing. And I felt so embarrassed at the time, but now I see that it's just this. Um, and that requires me to get out of the way. So the clinician would start off with what you feel is the problem, what you want to target, what you want to address, would hold the parameters there for you. So I often will tell my clients, like, if you don't need to explain those things to me. If you want to talk about it, we can. But I know sometimes, I can tune into when it's a little uncomfortable. Sometimes we use a couple of things. I tend to work with complex trauma, like pretty extreme cases, because I work in a practice where we have a lot of psychiatrists, and so they'll refer like their hardest cases to me. So that's just the population I work with. So I have all kinds of tools in my office. We might put some weight on your lap, or get you some, bilateral stimulation if you need that, or just different ways of grounding. So we've already kind of established some tools that work for you to keep you grounded while you explore the discomfort, because we're not trying to desensitize the discomfort. It's got wisdom we want to connect to, but we want you to also be able to be in a place where there's a balance, where you don't completely get siphoned into that scary thing, right? You're still, that's why we call it dual awareness. You're in the place of the observer, of knowing you're here, safe in my office, but also experiencing that thing that you didn't want to bring back up. Um, Depending on the individual, I've had individuals go through this in a matter of minutes, make some connections, especially like the metaphorical aspects of it when it shows up that way. But I've had others who, I've like an individual who has like DID, dissociative identity, a lot more complex, a lot more prep, a lot more safety, because now you're establishing rapport with multiples, not just one. When there's a lot of my clients with BPD, they will go through that push, pull, which is okay. I'm still there. So run out, curse at me one day, I'm here into the next week. And we're going to start again, and we're going to keep going. And I am okay with that. Like, it's a part of that process, because it's uncomfortable. And I recognize that it's uncomfortable. And that's an adaptive response of, I'm going to leave you because I'm getting too close to you. You know, that's a protective mechanism. I'm okay with I'm okay with that being part of the process. I'm still here. So you need an individual. If I was like dealing with my own sense of rejection, I wouldn't be able to authentically hold that space. That's why I needed to do my own work, to be able to say, like, wow, this is really rough for you. I'm still here. When you're ready, you come back, and then we pick it up from where we left off. And that's the difference, because I'm not having a certain, expectation of what it should look like, or a way to measure your progress and whether you're really serious about treatment, or I'm doing more work than you are. None of that. That goes out the window. Just holding the space, letting it be what it is, allowing you the safety to start to explore those very things that you've to avoid to survive. And yeah, hopefully that explains a little bit more of the process.
Yeah, no, so much of the why is coming up, right? Um, I was thinking people with borderline are probably going to have a lot more signals popping up that you have to
100%.
navigate.
Yeah. So, we start off with either the most obvious or where you want to work. There's some things that you have found to function, right? I have individuals who've been in relationships for a long time, and whatever they're doing is working for them. We start with the thing that's not working, right? We connect. They're very familiar with, I'm not giving you the answers. I don't have the answers. I tell people I give bad advice, man, because I'm very biased. I'm like, just don't listen to my advice. But we laugh about stuff sometimes. But we can hold a curiosity to see what awareness, what your wisdom shows you. So I had like an individual who's telling me, was really embarrassed, because she's like, I get jealous of my daughter and her relationship with her father. And I feel that whenever they're close, and I should be happy. I should be happy as a mom that she has that. That's why I picked a good dad for her. Why am I jealous? So there's the signal. Let's explore that feeling in your body. And of course, it connected back to, some earlier part that felt abandoned. And it doesn't always show up as parts work. I want to make sure I say that, because sometimes, there's approaches that use parts work, or different selves. it could show up that way, but not everybody processes that way. This particular individual did, and found that younger teen that was still grieving not having that connection, with her father. So she was able to connect with that, and kind of um, see her, be with her, connect with her, reconcile that. And it was a feeling in the body of connection that allowed the ease now to observe and even appreciate her relationship, her, daughter's relationship with her husband. So it's very different. Instead of targeting like your thinking, regulate, try to like get that anxiety down, use self-talk, what meaning are you? Let's give it a different meaning. All of these things are helpful, but they're kind of surface level, very different from like getting to the root of that moment something was ripped from you. Be with that younger Sarah. What would you tell her? What is it that she needed to hear? What is it that she didn't understand then? What is it that you can give her? You connect with her. And that experience, it changes how that's stored in our brain. It's the neural pathways that shift. That's the integration piece. It updates that. And now I have an adult that sees me. I have an adult that validates that. And it's me. And you always have access to you. That's why it's so important that it be you, because I can't go home with you. I'm not going to set you up for failure. But being able to guide you through that is really key.
Mm. And this is so powerful. This reminded me recently, my therapist hit me with like, I've been working with my therapist for about 5 years. So, there's that rapport established. But she said to me, like, for so long, it's been teenage Sarah that has been operating, right? Like
Mhm.
teenage angry Sarah has been in control. And like, like this is kind of like you're taking back and operating from adult Sarah now. And like, it's hard to be an adult sometimes, but
Oh
you
my
don't
God,
have
it
to go
sucks.
back into teenage Sarah to cope. And I was just like, oh my God, I'm 32 and I'm just now like an adult for the first time, so funny, but so real.
But you know what? Even we're all faking it. I don't care what people say. We all fake it, and there are moments instead of labeling it adult or child, I'm like it's tools that you have,
Yeah.
right? It's adaptive. So for me as a kid, I mean, I learned how to fight. I was a scrapper because I thought I was dumb, which brings me to the critical memory of I went through like physical abuse, emotional abuse, the religious cold, poverty, all of it, you name it. But this moment in kindergarten of being monolingual Spanish speaking, and this kid next to me didn't know his last name, became pivotal in terms of how I perceived my capacity, my intellectual capacity. Because I remember, I mean, they put me at the table to help me, right? Because I'm Spanish speaking. But I was trying to make meaning of it. And I remember that day because I was like, well, no, I want to sit over there. No, you belong here. And I remember the moment, like Louis said, he didn't have a last name. I was like, oh my God, this kid's an idiot. Then I thought, wait a minute, I'm sitting at his table. Oh shit, I'm an idiot too. And I remember being like, oh man, like sad. But I also had ADHD. I didn't know I had ADHD. So I think I got over it really quick. Like, well, I guess it is what it is. And that's probably part of my resilience. But that was a pivotal moment. I mean, I straight up failed fourth grade, straight F's, horrific. I had like freshman remedial English. I don't even know how I squeaked by to make it through graduation, but I thought I was dumb. I thought like academically didn't never really tried. It just that was my reality. It's clearly false. I mean, it wasn't until later when I became passionate about um I didn't know I'd be a therapist when I grew up. That was never like my plan. But when I had to do like my master's in order to continue practicing, because I had been able to work with kids as a bachelor level for a while, I had straight A's. How? How is it that I could get straight A's in college? It doesn't make sense because I'm supposed to be dumb. I'm supposed to be like less than, and yet I was performing higher than some of my, other classmates. And those are kind of the situations where I'm like, that doesn't make sense, right? That what I thought was my capacity, that was clearly false, right? But how many of us do that? Like, I'm not worthy. in this little, and you never know, it was some dumb kid that didn't know his last name next to you. You're like, oh, we're the that's not on the checklist of traumas that you experience. Like, it couldn't. And yet it was a pivotal moment. It was very critical moment. And those little moments that then dictate and limit you for life, and you don't even know that you're being limited, that's what we're trying to get to. And the only way you can get through that is through the experience, is following that thread of that signal, getting to that moment. You have that aha. The fighting piece, I kind of joke around about how, like, I mean, it worked, it kept me safe, but you can't do that as an adult. Like, HR gets involved, and PO and all this stuff. Like, it's frowned upon, but it's a valuable skill to have. I mean, if my kid was to get assaulted somewhere, like, and I step in, it doesn't mean I get rid of it. I just need to expand from it. Here are the things that we learn to survive. Unfortunately, we focus too much on extinguishing it instead of integrating it. So I tell people, you could still serve that dish as an option, but expand it. Give yourself a whole, like, what do you call it? Like, I'm thinking of that restaurant where you go and there's all these dishes. You can pick what you want, right? Make it a buffet of options. That's where you get agency. You can decide, do I need to bring up that part of me, or do I need to approach this way? That skill. We call it all experience. We don't call it parts. It's experience. Do I bring this expertise of mine, or do I bring this other one? What outcome do I want? Now you have agency, because now you can influence. You can be aligned with who you are and what you want in that interaction. That's what makes the difference.
Yeah, I'm thinking like this married with our DBT skills has to be really powerful, like in terms of functioning in a way that helps you get where you want to be.
Yes, because any of those skills, like, I was trained to teach coping, anger management, right? Control techniques, all of these things, be aware of your thinking, but it becomes this constant managing, this constant coping. When do you just live? Can you just be and not have to constantly be like trucha, on edge, seeing if it's going to show up or not? And the way we're doing CMI, the work that I'm seeing is like those skills are still valuable, but we call that containment. Right? In the moment, it might not be safe to express this or explore it or connect to it. So you need to use some of those skills to hold off, but you need to come back and figure out what that signal was telling you, what that feeling was telling you. Where is this coming from? Especially if it doesn't match the situation, or if it's keeping you stuck in a loop with behaviors that you're like, this is not giving me what I want in life. Then you need to explore it. So those coping strategies are really just meant to be temporary, right? Immediate, in the moment, so that when it's appropriate, I can do the deeper connection, because it's telling me something is needing my attention. And until I really get to the root of it, you're constantly trying to manage. I
Yeah,
don't
because that thing is going to keep coming up.
It does. I had an old minivan in college called the Mr. Greenbean, and he had like some steering wheel issues. So every 2 weeks I was buying stop leak because I couldn't afford to get it fixed, So I spent like $5 on this like stop leak, and it'd be like, so I had to pour it in there, and it fixed it, but it didn't.
Right.
Right? It took it through the next couple weeks, and then until I had to do it again.
Mhm.
And really, until we go and get that part replaced, until we connect it or whatever was going on, it was a constant management issue. And a lot of us, the skills that we've been taught, even as a therapist, what I was teaching clients before was how to manage, how to cope, and it just wasn't enough.
Yeah, it's not enough. It helps us be functional, but it doesn't necessarily help us feel happiness or joy or like get rid of shame or those kinds of things.
Yeah, understand the shame, understand even that when people are saying you have to be self-compassionate. Do you understand how that works? You can't just like, let me be compassionate and nice to me whenever my body's like still rejecting something that I refuse to accept. It's not it Self-compassion comes from understanding, and you can't understand something that you're not willing to look at
Mm-hmm.
or explore. And that's where we get stuck in that loop. So working through this we're really starting with what the individual's ready to go towards. So I don't do that whole big T traumas, little T traumas. Like we don't even go through some people will share some of that with me. Cool. But I'm not going to assume that that's where the answer is, because a lot of times what we're integrating actually impacts how they view those things, and they don't even need to visit those things. It already changes the way they perceive it. It
Hmm.
changes the way they experience it. And I knew we had something different the day one of my clients came in. He had one with one of the most horrific, histories when you're talking about like meth abuse and childhood abuse from like age 7. And after all the work, and we did a lot of integration with CMI, came in and said, I actually welcome flashbacks now. And I was like, what? Wait a second. Can you rewind? Tell me a little bit more. What do you mean by that? And he said, because it was the very thing that he came to see me for at the beginning. He said, I mean, don't get me wrong. It's uncomfortable, because there's a lot of trauma that he had experienced. He said, but I'm willing to go there because I know there's something I'm going to learn about myself. I know there's wisdom. There's something I'm going to get from that. And so I really welcome it because I know it's going to be this like aha. And he gave me the example of what had happened with his partner and how he said, you know what, instead of reacting and calling him out on this, I'm going to sit and see if this is actually coming from me. He said, when I sat and it connected to this other thing, completely changed. Like I understood this differently. And I recognized it's like, and it was uncomfortable and the shame came up, but I could handle it. I could hold it. You could hold the shame. You could hold the fear. You could hold all those things and not be derailed by it. That to me was powerful. That was the last, I was like, you go with your bad self. You're ready,
Yeah, you are ready. You are ready.
Yeah.
Yeah. Mm. That hopefully is like motivating for people who have been so afraid to start. Like it can get so much better. It can get so much better. But when we're so afraid of like returning to the pain points, we
Yeah.
just keep experiencing the pain points.
And we could say all the time, like, you already survived that thing. You're already on the other side. We just need to catch your brain up so your brain knows that too. So your nervous system knows that you're on the other side. Here's the biggest tragedy, Sarah. Like, this is kind of what drives me. And I thought this might sound a little weird, like when I was earlier in my career, because I had to work through a lot of my own stuff too. But I used to go to like the cemetery to sit there and look at the dates. And I saw how some people got to be here for 72 years, 90 years, 13 years, 8 years. And I'm like, it doesn't matter who you are. Our time is limited, right? Our time is like, there comes an end. And the biggest tragedy isn't what we survive in life. The biggest tragedy to me is that we never break free from that. And when I read, I used to read a lot of books on like death and dying, and there was one that said the top regrets. The things that I saw that were very similar among all of them was some of the top two regrets was I wish I didn't care so much about what other people thought. And I wish I wasn't so scared to do what I really wanted to do. And to me, that is the tragedy. Because we're so much in survival, we never actually get to live our life. Everything that we're doing is reactive, protective, defensive, or whatever it is, based off of what other people put on us, what other people didn't work through. And, they say like the present is a gift. I said, yeah, sometimes it's regifted. They didn't work through this stuff. And that saying of if you don't transform trauma, you transmit it. But it's the same with beliefs. It's the same with rigid, like inability to allow the freedom to be who you are. So whether it's a trauma or whether it's like very rigid parents who expected you to be a doctor or you to be this specific thing, and that's not who you were wired to be, that could be very devastating too. So it's about becoming authentically you. It's about really being able to experience life, what it has to offer. The tragedy will always be there. The challenges, the adversity will always be there. But will you come at it from your experiences and your adaptive responses? Or will you come at it with agency, with understanding, with intention, and the freedom to choose?
Yeah, yeah, that's powerful. So, if anyone listening wanted to find a CMI clinician, how would they go about doing that?
I'm so glad you mentioned that too, because as a clinician to clinician, part of the challenge, when we come up with something like this is that our industry really requires us to like study it. And we're in the midst of like, collaborating with the university right now to do the studies, but that could take decades. It could take decades before it's established as evidence-based. And CMI really has been established off of all the research and everything that we've experienced. So what we are doing right now is trying to get more clinicians trained, trying to get the word out there that, hey, this is an approach that, yeah, has been developed from multiple, there's several of us that have contributed, but it really is aligned with what science says about the brain, about emotions, about the sense of self. But right now, because it hasn't had the published research, right, that it's we're at this place that we're trying to get the word out because we feel the urgency of the need for something different in our field. And so visiting our website, arisealliance.org, would be the first step to go. If you're a person that's looking for a clinician, tell your therapist about this. We have free webinars the first Wednesday of every month where they can come as a professional and ask the questions about the modality. We could talk about like, here's the research behind everything that we do. But tell your therapist about it. We are a nonprofit organization as well. So, if there's groups out there that can train, we're willing to work with them. That's why I joined this organization, because I felt like the mission had to be greater than what we're getting out of it. Like so we work with individuals. So if you don't have a provider near you yet, we have trained some clinicians. I know we even have some in Madrid, Spain. Went out there, yeah, but it just was launched last January. It's about a year and a half in. And as you know, to have a new approach out there is like, everyone wants to know what makes it different, what makes it better. It's not better, it's integrative, right? It's the map that helps you be more clear and adapt to what the individual needs. So yeah, feel free to connect with us. We also run workshops because I want to make some of this information accessible for, I've presented at like police department or the city, here in Chandler, I actually am doing a public workshop that they're sponsoring. I'm so excited about that. That is teaching some of these concepts, giving some of these skills. So we do a lot of collaborating with like nonprofits or with organizations that might want to do like a non-clinical, more normal training to help the individuals in their department or their organization. So there's a lot of opportunity for you to have access to some of this information. But if you know any clinicians, any mental health professionals, please, refer them to us, connect them with us. We're happy to sit and share and answer questions. And then if they attend the webinar, they get a discount too. So worth
That's
it.
awesome. And where can people follow you if they want to follow you and what you're up to and maybe work with you in Arizona? Where can people follow you?
Yeah, so arisealliance.org, I think we have like a Facebook page and Instagram. I
Hmm.
think our person will send you the info because I'm really bad at that part. But if, for clients, anybody in the Phoenix area, I mean, I do practice just 2 days a week, so it's kind of hard sometimes to get in on my schedule, but I practice at Lighthouse Psychiatry in Gilbert, Arizona, Lighthouse Psychiatry and TMS. So we do everything from TMS, Bravado, ketamine. We're doing some psychedelic research there. So I'm also a dosing session monitor for some psychedelic studies we're
Oh,
doing
wow.
there. But that would be the place in person. Yeah.
I love it. I love it. For everyone listening, links will be in the show notes. Thank you so much for your time. I'm really excited. I'm going to follow along. I'm going to sign up for the email list and see what's happening. Maybe I'll pop into one of those webinars. It sounds like really good
Yeah,
work.
that would be awesome, Sarah. Yeah, thank you for having me and thank you for connecting.